After pregnancy, every expectant mother is concerned about how her baby is doing and how the baby is growing. Throughout the pregnancy, different symptoms appear, which can help you understand whether the baby is healthy or not. So in today's video, I will discuss the symptoms during pregnancy that may indicate your baby is not doing well. Let's get started. 1. Bleeding. After conception, a woman's body usually increases the production of the hormone hCG, which stops her monthly period. That means periods should stop after pregnancy begins. If bleeding occurs any time after a positive pregnancy test and before delivery, it is a cause for concern. If bleeding occurs before 20 weeks of pregnancy, it could be an early sign of miscarriage. If bleeding occurs after 20 weeks, it could indicate preterm labor, or labor starting before its proper time. Additionally, bleeding during pregnancy can be caused by issues related to the placenta, which can lead to oxygen deprivation for the baby. Remember, you should not have periods during pregnancy. Any bleeding is a sign that something might be wrong with your unborn child. Seek advice from a gynecologist without delay. 2. Abdominal pain. Mild abdominal or back pain is quite common during pregnancy. Occasional light pain that resolves on its own is usually normal. However, persistent pain in the lower abdomen or lower back, or pain that gradually increases, could be a warning sign. Normally, after conception, the embryo implants into the endometrium, inner lining of the uterus. But if the embryo implants outside the uterus and starts growing there, it's called an ectopic pregnancy, a serious and life-threatening condition that causes severe abdominal pain. It could also be an early sign of miscarriage. If you experience severe abdominal pain during pregnancy, you must consult a gynecologist. Getting an ultrasound scan within the first 3 months of pregnancy is best. 3. Premature rupture of membrane inside the womb. A baby grows within a thin, fluid-filled sac called the amniotic sac. This sac is filled with amniotic fluid, which protects the baby from infection. Just before delivery, the sac normally breaks and water comes out, commonly referred to as the water breaking, signaling the onset of labor. However, if the amniotic sac breaks before 37 weeks, it is called preterm prom. If a pregnant woman experiences water breaking between 7 to 9 months, it is a serious issue. This can lead to infections or even premature delivery. The good news is that with timely medical attention and proper care, this problem can be managed. That's why it's important to track your pregnancy week by week. If your water breaks before 38 weeks, consult a gynecologist immediately. 4. Less fetal movement. Fetal movement usually begins to be felt after 5 months, 20 weeks, of pregnancy, although some women may notice it around 24 weeks. If you don't feel any movement by 24 weeks, it may indicate intrauterine growth retardation, IUGR, which means the baby isn't growing properly. Between 7 to 9 months, monitoring your baby's movement becomes very important. Problems don't usually happen suddenly. Lack of movement can be a warning. If your baby moves at least 10 times every 2 hours, they are likely doing fine. You can best observe movement after meal. Lie on your side after eating and count if the baby moves at least 5 times in 1 hour. Do this after each meal, 3 times a day. If you notice less than 10 movements in 2 hours, consult a gynecologist immediately. It could be a warning sign. 5. Headache and blurred vision. During the last 3 months of pregnancy, mild swelling in the legs is common. However, in some cases, blood pressure may increase, a condition called preeclampsia. Symptoms include headache and blurry vision. If a headache lasts more than 24 hours and is accompanied by vision problems, seek medical help as soon as possible. If you notice any of these 5 signs during pregnancy, it may indicate your baby is not doing well. In such cases, always consult a gynecologist and get an ultrasound done. I hope today's video was helpful for you. If you find the video helpful, don't forget to share it with your friends. Please subscribe to the channel to get health advice, health awareness, and reproductive health related videos. And remember to become a member of our family. Thank you for watching this video.